Hello and good morning, dear viewers. You're most welcome to the DAKTARI program, health episode which airs on National TV every Thursday from the hour of 11 a.m. to noon, where we bring you people in the medical field to educate you, our viewers, matters regarding your health. And this month, specifically it being in November, is an AMR awareness month, which is antimicrobial resistance awareness month. And we have had scenarios of people in the community there. Whenever you get illnesses, you go out to drug shops, clinics, buy drugs, you self-medicate without prescription from a physician or a doctor. And on the long run, when you maybe go for advanced maybe illnesses, to go for the same drug to treat the illness, your body system does not respond to these drugs. And this is what we call antimicrobial resistance, where now you have to visit maybe a diagnostic center or clinical lab center where they will have to do culture and sensitivity. Today we are going to reveal around culture and sensitivity, microbial culture and sensitivity tests, such that you get to know what they are. However, before we delve into what microbial culture and sensitivity tests are, let's first get to our guest. Let him introduce himself, then we shall pick on from there. Thank you.
Dear viewers, my name is Charles Kayuzu. I work with MBN Clinical Laboratories Arua branch as a laboratory technologist. We are located on Poloti 11, Oda Road, Anyafio. It is a pleasure to be part of this show. And at MBN we offer a variety of services. We do PCR tests. This is HIV PCR, Hep C PCR, hepatitis B viral loads. We do also chemistry tests. In this case, we are checking on the functionality of the liver, the kidneys, the cholesterol levels, the thyroids, fertility hormones. At MBN, we also do cancer markers. An example like prostate cancer, liver cancer, cancer of the ovaries, cancer of the adrenal gland. We also do confirmatory tests for typhoid, brucella, syphilis, HIV, hepatitis C. Yes, and we also offer DNA paternity testing services.
We are grateful to MBN Clinical Labs giving in the facility and also their lab technician to come and educate the viewers of National TV. We would love to pick on from you, Mr. Charles. We are hearing of microbial culture and sensitivity tests because we have been having patients or maybe community members use the drugs which used to heal the same illnesses, but now the body system does not respond to these drugs which used to work those days. We would love to know, what are these microbial culture and sensitivity tests?
Like you hear the word microbial culture and sensitivity, it is stemming from two words, culture and sensitivity. So I will start by defining what microbial culture is. Simply, microbial culture is the process of multiplying microbial organisms by letting them reproduce in predetermined media under controlled conditions. These microbial organisms, or what we can call germs, could be bacteria or fungus. Sensitivity on the other side is just a test done to check the effectiveness of a drug against this microorganism that we have multiplied in the laboratory. So to put the two words together, we define microbial culture and sensitivity as a method of multiplying microbial organisms on predetermined media and perform tests to determine the effectiveness of drugs towards these microorganisms.
I hope our viewers have gotten to know that now they are getting these microorganisms and they are growing them. Is it like a garden? However, you will let us know. And also, how do you talk of media? Are you meaning this social media we're always hearing of, like the internet? We would love to know which media in regards to this culture and sensitivity.
When we talk about microbial media, in simple understanding, we could define this microbial media as a substance or a special substance we use in the microbiology lab to culture or to grow these organisms. Simply, that is what media means. It's a special substance with special nutrients that favor the growth of these organisms.
You have taken us through what a media is, like where you grow these microorganisms. However, we would like to know, could there be some examples under each of these classes?
There are very many bacteria we isolate, but I would choose to give you the most common ones that could be causing problems or burden towards this AMR. The bacteria, the most common bacteria which we have is Escherichia coli, Pseudomonas aeruginosus, Staphylococcus species, hemolytic streptococcus. So, and under fungi we have the most common one being Candida albicans.
Then also we would love to know from you, why could it be vital or necessary for a patient or maybe a client or a community member to do a culture and sensitivity test before they start prescribing or maybe taking their medication?
This being a month for antimicrobial resistance, and we very well know that one of the contributing factors to antimicrobial resistance is self-medication. In other words, you suffer from a disease even without knowing what type of bacteria that is causing the infection. You rush to take antibiotics. With culture and sensitivity, we shall be able to prevent or combat this existing antimicrobial resistance by identifying the organism that is causing the infection and probably the drug that is most likely to clear out the infection. So why would one do a culture and sensitivity test? Would be first of all to help you diagnose the infection, to know the infection you're suffering from. Like I told you, we identify this organism and go ahead and expose it to a number of antibiotics to determine the effectiveness of the drug. Another reason as to why one would do a culture and sensitivity test, it is to provide your clinician, health provider, with which medicine or the exact medicine you can use to treat your infection.
Hope our viewers have gotten to know why it could be vital for you to do a culture and sensitivity test before you go into maybe taking medications at home without even any form of clear prescription. Then we would love to know from you, Mr. Charles, what are some of the do's maybe the patients or maybe the viewers should do when they are opting to come and do these culture and sensitivity tests in these clinical lab facilities?
We normally advise patients to abstain from antibiotics or antifungals for about 2 weeks. We do this because prior exposure to antibiotics and antifungals could reduce on the bacterial or fungus detection. But just like we said, antimicrobial resistant, it means even if you are exposed to this drug, it means this drug is not working for you. So you can still come and do this culture and sensitivity test even when you are on antibiotics. But the best will be 2 weeks, will be abstaining from antibiotics for about 2 weeks.
We are getting on to know and understand why a viewer should go and do this culture and sensitivity test. However, in the course of that discussion, you talked about picking samples. We would love to know and elaborate more for the viewers. What is a sample and which kinds of samples you guys always pick from a patient?
We test a variety of sample. All the do's and don'ts depend on the type of sample or tissue being taken. A sample, I would define it simply as something that we are going to collect from you that will help us to capture the organism and multiply it in the laboratory. Yes. We do culture and sensitivity on a number of samples. For example, we can do culture and sensitivity on a urine sample to rule out UTI. Normally, UTI in women, urinary tract infections caused by Escherichia coli, Pseudomonas aeruginosus. Maybe you could elaborate for the viewer what a UTI is. Yes, a urinary tract infection is a very broad thing, Mr. Moderator. But I would simply define a urinary tract infection as an infection caused by bacteria when it enters the urethral system and cause an infection there.
Thank you very much, Mr. Charles. However, we would love to know, you have told us there is maybe these microorganisms they enter into the urinary system. We would love to know, how could these microorganisms, maybe these bacteria and fungi, enter into this urinary system?
For example, the bacteria, when you're having sex and the bacteria of the skin enters the urinary tract system, it could cause, or it could be one of the causes of what? Of UTI. Then also the bacteria from the anus, okay, could also enter the urinary tract system and cause this infection. Because normally we know it can enter there due to hygienic reasons or hygienic measures, whereby in females, for example, we are advised to clean from front to back. But scenarios where you clean from back to front, you could be introducing this bacteria into the urinary tract system to cause these UTIs.
Female viewers, please, in case you are going to ease yourself in the toilet, he has told us or advised us we should wipe from front to back. However, we would also love to know from you, what are some other samples you guys always do to these clients or patients whenever they come?
Yes, we also collect a high vaginal swab for women and a urethral swab for men to rule out STIs. STIs these are sexually transmitted infections caused by bacteria, and this bacteria can be Staphylococcus, Candida species, and very many other bacteria. Yeah, in culture and sensitivity, we also collect a blood sample. We have had cases of people complaining of typhoid, treating and it's not healing. So we can also do a culture and sensitivity on a blood sample to rule out typhoid, brucellosis, and other bacteria that could have been introduced in the body causing bacteremia. We also collect lung secretions. In this regard, we are going to collect sputum, and with sputum we are going to rule out mycoplasma tuberculosis and Staphylococcus aureus, strep pneumonia. Those are the bacteria that normally affect the what? The lungs. So we can collect a sputum sample, culture it in the lab, and rule out causes of what? Of these infections or occurrence of these organisms there. We also have throat swabs, and these throat swabs are collected to rule out the most common bacteria that causes infection around the throat is beta hemolytic streptococcus. So if we collect that sample and culture it, we can be able to identify that bacteria. We also have tissues. In this regard, we are talking about skin. It could be nails. It could be a skin tissue. You know, you understand the skin, is it? Yeah. Okay. It could be skin scrapings or nails. Normally, these ones are for fungus infection. Okay. Much as we can also isolate them and find E. coli and Staphylococcus aureus. We also have exudates. Exudates, these are tissues, these are fluids coming out from, it could be a wound, it could be an abscess, but a fluid coming out from that wound. We can also swab and collect that. We can also swab and take that swab for culture and sensitivity to determine the causes of that exudate coming from what? From that wound.
However, Mr. Charles, we would love to take us through the field of how you guys always collect these samples. Do you always, now like I'm imagining doing a high vaginal swab, some women may be maybe shy to come and do such tests. We would love to know from you, how do you always collect the feel of how you always collect these samples and how you always assist the clients?
It is true some women are uncomfortable when it comes to collecting samples from them. Some feel shy, like you've described it. But when you, like I said at the beginning, that some of these samples can be collected by an individual, though some are collected by MBN staff. So when it comes to sample collection, I would advise our viewers to come to MBN Arua Lab in Anyafio for our staff at MBN to guide them through sample collection. Though some samples will be collected by the staff at MBN and others will be collected by them. For example, a urine sample could be collected by a client after instructing them on what to do. A high vaginal swab a sample can be collected by our staff at MBN, which and in case the client is not comfortable with a male person collecting the sample. We have other female staff that I didn't move with here.
So hope the viewers are getting to know if it is in regards to shyness, please, whenever you go to facilities, you could find a male or female attendants who will be waiting for you. Then also we would love to know from you, Mr. Charles, in regards to this sample collection. One thing you skipped out, we saw stool. Maybe when children are growing up, we see them, they ask for stool as a sample. What tests do you guys always do in regards to stool? Could it also be taken for culture and sensitivity, or it's many other tests?
That is a very good reminder. I'd left out stool. Yes, stool can also be taken for culture and sensitivity, especially in the cases of ruling out salmonella or shigellosis infection. So stool is also one of the most asked samples for culture and sensitivity. We do it, and the collection can be done at MDN or can be done at home and deliver the sample to MDN.
Thanks very much, Mr. Charles, in regards to that sample collection. However, we would love to know from even the viewers of Westnile TV, what do you guys always do with my sample? In case you have come to the facility, you have picked my sample, what do you guys always do with the sample?
I'll give an example of urine. When we collect urine for culture and sensitivity, the very first thing we do is to culture it on a specialized media. Remember, when we started this conversation, I defined culture as a method of multiplying these microorganisms on a predetermined media, okay, under strict conditions, under favorable laboratory conditions. So the first thing is to inoculate this sample or to introduce this sample on the media, right, where we expect it to multiply, okay? And normally this one takes about 24 hours to 48 days, okay? Once these organisms have multiplied or they have grown on this media, we go ahead in the process of identifying the organisms that have grown, okay? The identification process involves a number of biochemical tests, a number of tests that are done, gram staining, which I may not be able to elaborate to our viewers. But the next step is to identify this bacteria. Maybe one thing that I didn't talk about is, much as we are here to identify the bacteria that has grown, we have to put it in mind that our bodies are full of what we call normal flora bacteria. Okay? The bacteria that we isolate will depend, or we shall continue with the test depending if the bacteria is pathogenic or not pathogenic. Okay, after the culture, we shall go on an identification stage. Maybe what I forgot to tell you, Mr. Moderator, is that much as we are going to multiply these organisms, we have to put it in mind that there are organisms that are known as normal flora. These organisms are supposed to be there for the betterment or for the good of our skin, for the existence of the vaginal fluids in the women. So, as for us to continue to the next step, which will be sensitivity testing, will depend on the pathogenicity of this bacteria. Take an example. If a bacteria of the skin, the coagulase negative staphylococcus, is isolated in a urine sample, unless its significance is validated, that's when we continue to do a drug sensitivity testing.
However, we're going to first break off for a short commercial break, and we'll be back in the next segment where Mr. Charles will take us through the duration after which your results are always back after they have picked your sample, and also will explain for us what is the word pathogenicity. Let's get back. Thank you.
Westnile TV, lighting up the region.
Mbappe! Jude Bellingham, Vinicius Jr., Lamine Yamal, Antoine Griezmann. La Liga comes to Star Times.
A wild celebration!
The big stars, the tiki-taka football, Real Madrid and Barcelona live in your living room.
Real Madrid, a team of dreams!
Catch all 380 games live and in HD on Sports Premium Channel 259 and Channel 246 starting this August 15th. Subscribe to StarTimes Classic or Smart Bouquet at 36,000 Uganda shillings to enjoy the football experience affordably. StarTimes Football and limited passion.
Ekiki? Owangula. Nsasula emyezi 3 n'empangula. Hey! Ha!
Abaye, kubadde ki?
Kituufu ensasula emyezi 3 mpangula. Kituufu.
Subscribe for 3 months to any package of your choice or grab an Azam TV kit and pay for 3 months and stand a chance to win life-changing rewards. Android smart TVs, fridges, motorcycles, and that is not all. You could walk away with free subscription or the grand prize of 20 million Ugandan shillings in cash. Yes, 20 million grand prize. Subscribe today and enter the draw. For more information, 031 2308 900 or visit any Azam TV dealer near you.
Azam TV, entertainment for everybody.
In the dance of shadows and light lies the heart of Uganda's resilience amidst the challenges of the night, where innovation meets necessity and education refuses to be dimmed, where connection thrives in the absence of power. Embrace the power of the sun with StarTime's solar range of solutions and empower your journey towards a brighter tomorrow. StarTime Solar. Power your life.
West Nile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial breather. Today we are joined with Mr. Charles Kayuzi from MBN Clinical Labs, who in the first segment took us through what these microbial culture and sensitivity tests are, where he briefly elaborated to us that these are tests done to grow microorganisms we have in the bodies to know, help identify the appropriate drugs which are meant to treat these microorganisms. Then also, before we had a break in the first segment, I talked of the word pathogenicity. We would love to know from you, Mr. Charles, what is pathogenicity? And also, you tell us how long do these results take to come back after the tests are done?
Pathogenicity will simply mean the ability of an organism to cause infection in another organism. For example, I will give a pathogen like coagulase negative staphylococcus that I told you is a skin flora. So when we isolate it and find it in urine, we assess its ability to cause infection in what? In the urethral tract system. Yes. About how long it takes to get results, most cultures and sensitivity results can be got within 3 to 5 working days, with the exception of blood culture and skin scraping, which takes about 21 days for skin scraping, then for blood culture about 5 working days or 6 working days. However, there are other cultures. For example, a culture to rule out brucellosis also takes about 3 weeks. Those are 21 working days.
We would love to know from you, even I know the viewer would love to know from you. How do you always advise these people in case the tests have come out, maybe you picked someone's urine sample, you have confirmed maybe they have a UTI. How do you always advise or the next steps you give to these clients to pick on and do?
I want to let you know that not every culture and sensitivity result will be positive. So we have both positive and negative culture and sensitivity results. I will start by elaborating more on the positive culture and sensitivity results. A positive culture and sensitivity result is a result that we have isolated a bacteria, okay? We have isolated a bacteria that is causing a disease, and we have gone ahead to do a drug sensitivity test. So when such a result is given to our client, we advise them to go to their doctor or to visit a medical center for prescription of the medicines that we have identified as effective to their what? To their infection. And then for a negative culture results, we normally advise them or we assess what could be the cause of the negative result. Like we shall see in front there, as we continue that discussion, we shall see what happens when someone has the symptoms, but they keep on getting what? A negative result for their culture and sensitivity. Then after you undergoing this treatment that is prescribed to you by your medical doctor or a health practitioner, we advise you to do a follow-up test after 2 weeks of finishing the dose of antibiotics or antifungals to confirm if the medicine really cleared off your bacteria or the fungus that was causing the infection.
Thank you very much, Mr. Charles. Indeed, it's educative, and I know the viewers are getting quick to know. However, I would love to know, you are talking of negative cultures and positive cultures. For you to come to such a conclusion, is it maybe when you go and find, you check out on these microorganisms, do they maybe to say it's positive, they have grown in
that sample, so we can regard it as a negative culture and sensitivity. For a positive culture, we are not looking at the quantity or the growth of the colonies on what? On the plate. For positive culture, normally it means this sample has passed through the stages of culture and sensitivity. Like I told you, we get the organism, we get the sample, we inoculate. After inoculation, there must be growth. So when we see growth on this substance, we go ahead to identify the bacteria or the organism that has grown on this specialized substance for what? For multiplying these microorganisms. So after identifying the bacteria, we go ahead and send the drug sensitivity testing to assess which antibiotic responds best or can kill that bacteria, or that is effective or that can clear off that bacteria in case it is used in what? In treatment. So a positive result or a positive culture and sensitivity result is one that has identified a bacteria and it has classified it as either pathogenic or non-pathogenic, and has also done or performed a drug sensitivity test to that bacteria.
I was perceiving it for you to say that this is a positive culture. It was all on the numbers. Maybe the number is much or small. However, also I would love to know from you, when you guys have done maybe a culture and sensitivity test, maybe it's positive, do you guys also determine maybe this person, maybe since he has this amount, maybe since it's positive, he should go for these drugs, or maybe they have to first go to their physician for the prescription of these drugs?
I don't want to say we determine, but these drugs have a zone of clearance, that diameter zone of clearance. So normally the drugs we give, or our results, come with the drugs that are more susceptible, that are intermediate and resistant to the infection. So when you go to your doctor, they look at the culture and sensitivity results, and they will prescribe to you the drugs that are more susceptible to the what? To the bacteria that are more susceptible, effective to the bacteria isolated. In this case, we use a diameter that is always in millimeters.
Thank you very much, Mr. Charles, for indeed that good discussion. However, as you are speaking, you've shown us that these culture and sensitivity tests, microbial culture and sensitivity tests, like will help you identify the appropriate drug to treat or maybe kill the microorganisms this person could be having in their body systems. However, could you give us some of the disadvantages? People going out in the drug shops, buying drugs without prescription and doing these culture and sensitivity tests, the dangers that they could be onto.
That is very dangerous, and I want to encourage viewers not to do self-medication. When you are sick, or when you're having symptoms of maybe a UTI or any other symptom that could be caused by a bacteria, I urge viewers to always go to a medical center and see a health provider. Do not go for self-medication. The burden of self-medication is what we call antimicrobial resistance, antimicrobial drug resistance. And with antimicrobial drug resistance, it will now bring in the burden of chronic and recurrent infections. Why? Because you are taking medicine that is not supposed, or that does not kill a particular bacteria that is causing an infection there. So that is why the issue of culture and sensitivity is very important, and viewers should embrace it, because it helps you to identify which bacteria is causing the infection and which medicines can be used to clear off that bacteria.
Please don't self-medicate. In case you get any illness, don't sit at home to buy drugs without prescription from a medical personnel. Then also, we have had scenarios, Mr. Charles, in the community, especially maybe for the ladies. They feel like they have signs and symptoms of maybe it could be these sexual transmitted infections. However, they go maybe to the facilities you guys test, and these tests are negative. How do you always advise or maybe guide such clients?
With such scenarios, it is true someone can come when they have the signs and symptoms, especially for the genital tract, symptoms in the genital tract, like abdominal discharges, itching, and we fail to capture them in the high vaginal swab culture for ladies and in the urethral swab culture for men. In such scenarios, we advise these clients to do what we call the multiplex PCR testing on both a urethral swab and a high vaginal swab. Okay? In such scenarios, we are trying to look for organisms or pathogens like Neisseria gonorrhoeae, Chlamydia trichomoniasis, Trichomonas vaginalis. These are some of the bacteria or the pathogens that cannot be captured in a high vaginal swab or a urethral swab.
So you talked of some microorganisms. We would love to know, like how do you say the gonorrhea? Is it the one which causes gonorrhea we always see in the societies?
Yes, it is true. I mentioned Neisseria gonorrhoeae. It is one of the organisms or the bacteria that is responsible for gonorrhea infection in women. Yes. Also,
in regards to what is common in the community, it's actually many of these sexual transmitted infections and UTIs which are more resistant to drugs specifically meant to treat them. What are some of the advices you would give to the viewers in order to safeguard themselves from this resistance to drugs, which may push them to go for culture and sensitivity?
I just want to make it clear that the STIs and the UTIs are not the ones that are resistant to the antibiotics. It is the bacteria or the fungus that are causing these diseases that are resistant to the drugs prescribed. The advice I would give the community is to always seek medical advice before taking to stop self-prescription. You have to, before you take medicine, you have to see a medical, a clinician or a doctor before you go and buy medicine. Then another thing is what we call sexual discipline, because most of these things are caused by having multiple sexual partners. The hygiene, especially for ladies, and we know the distance between the anus to the vagina is short. So it is very easy for a bacteria from the GIT, in this regard I'm talking about E. coli, to cross over and enter into the genital system. So the hygiene has to be also observed. We also have cases of increased use of bleaching agents. In this regard, people use soaps, spermicides, vaginal washes, those gels, much as they clear off infections, like they say, they could alter the normal flora in the In the vagina, for example. When I say normal flora, the vagina has its own bacteria that are responsible for maintaining the flora or the normal discharge of the vagina there. So as this bacteria is altered, it means it is going to cause infection, or there will be a bacterial imbalance in the vagina, leading to complaints like abnormal vaginal discharges, false male vaginal discharge, because the bacteria has been altered.
Thanks very much, Mr. Charles. However, I would love to know from you. You talked of some blood sample, of some sample results coming after 2 days, others taking weeks. We would love to know what are the parameters, or what pushes other results to come earlier and other results to come a bit late. Thank you.
So we have said that most culture results take about 3 to 5 working days. It is not 2 days. Okay. Because in our discussion, I said most cultures, almost bacteria, will give them about 48 hours to grow on a specialized media under controlled conditions. However, now while others take a little bit longer, like we talked of brucella and skin scrapings, take about 21 days. The reason is just because these bacteria grow a little bit slower than the rest. So that is the standard time recommended by the WHO for growth of this bacteria.
Also, I'd love to know from you, in regards to the sample collection, some people, again, in regards to maybe the female, they are always shy. Is it advisable maybe for someone, if they could pick their own sample, or maybe at home, and bring it maybe to the clinical lab for tests?
So I don't want us to dwell on the issue of females being shy, because if someone is sick, we do not expect you to be shy. Okay, when you come to the hospital, you expect healthy care, not something else from health care. The ideology, or we will not advise clients to pick samples from home, though other samples for culture and sensitivity can be picked from home. For example, we can advise you or instruct you now to collect a urine sample you can bring it and to MBN after collecting it from home. However, there are some samples that we cannot allow you to bring in. For example, high vaginal swab culture and sensitivity, you cannot collect it by your own unless you may be collecting it from, or it is your doctor collecting it. That's when we shall accept it. Like in the beginning, I told you some samples can be collected or are only collected by MBN staff. A sample like a sample like blood for culture and sensitivity, we know it comes with specialized sample collection containers, which you may not be having at home or which you may not acquire at an individual basis. So that's why we stick out to advise all our viewers who want to do culture and sensitivity results to come to MBN, and they will be guided where necessary.
However, also I would love to know from you, are there maybe some other tests which could be done to screen or maybe identify these microorganisms apart from the culture and sensitivity?
There are a number of tests that can be done before we go ahead and request for a culture and sensitivity tests.
All right. Thank you very much, Mr. Charles. However, I would love to know from you, in regards to the gonorrhea, you talked of the multiple PCR test. I would love to know from you, is this test also mainly specifically for gonorrhea, or it could be done for other samples as a way of testing these microorganisms?
I don't want us to say it is done for gonorrhea. We say it in samples like high vaginal swab cultures, where there are pathogens that cannot be captured at culture. For example, we gave an example of gonorrhea, trichomonas vaginalis, and trichomonas vaginalis. Now, we do PCR not only on HVS samples. I'll give an example. If someone comes to do a sputum culture and sensitivity for MTB, okay? In scenarios where we fail to isolate the MTB, we go ahead and do a highly sensitive test known as MTB PCR. Okay? Yes. For samples like blood, we can also do blood to rule out typhoid infection. We can, in cases where we cannot do a salmonella culture and sensitivity, we can go ahead and do a highly sensitive test known as the Salmonella IgM. This is a chemistry test and ELISA that will help us know if we have an active infection or we were exposed to the infection before.
All right, thank you very much, Mr. Charles. However, I would love to know from you, in case maybe someone also came maybe to a clinical labs facility, you guys have done your culture and sensitivity, you found out maybe it was positive, you have advised this person has gone to the doctor, maybe they have prescribed for him drugs. Is it necessary, vital for this person maybe to do a follow-up test, maybe in regards to this same microorganism, maybe to do another culture and sensitivity?
It is very important for you to do a follow-up test, to do a quality check, to make sure the drug we have given you has cleared off the bacteria. We normally advise our clients to come for a follow-up test after 2 weeks of completing antibiotics or antifungals. Why? Like we started this discussion, I told you it is always advised for someone to come for this test 2 weeks prior use of antibiotics, because prior use of antibiotics makes it or reduces the chances of bacterial detection in cultures, though it does not limit bacterial detection, because already there is a resistance. So in case the bacteria is resistant, definitely we shall be able to isolate it on on cultures.
However, also I would love to know from you, we have seen people in communities get typhoid. There's also typhoid, maybe to confirm whether the microorganisms causing this typhoid. Do you guys also do culture and sensitivity for typhoid for someone to confirm that they could be positive?
The cases of typhoid outside there are many. Everywhere you go, they say typhoid. At MBN, it is possible we can do a blood culture and sensitivity for salmonella, to isolate salmonella. Then we can also do a stool culture and sensitivity to isolate salmonella and shigella. So it is very possible to do a blood culture and sensitivity for typhoid infection or to rule out typhoid infection. And we can also still do a stool culture and sensitivity to still rule out the same infection.
Indeed, it has been an exciting episode and educative. I hope also the viewers, you have got to learn things regarding your life before you go for self-prescription or self-medication. Taking these drugs without guidance from your medical practitioner, it's bad because you get resistance strains. And also, it's advisable for you, before even you go on treatment, please, you do these culture and sensitivity tests. And come back to you again, Mr. Charles. You can give in a package and a conclusion remarks for the viewers as we have come to the conclusion of our program.
Dear viewers, as I conclude, I want to urge all viewers that this issue of antimicrobial resistance is a burden, and it has caused a very big health impact on our community. So as we have discussed about culture and sensitivity as one of the reasons or one of the ways of combating it, I urge members to come to MBN for this and consume up these tests so that we kick out this burden of antimicrobial resistance. Moderator, you see our time has not been, you have not given me enough time to exhaust out everything, but I will urge our viewers to call us or contact us on 077 67 39547. I will repeat the contacts for them: 076 73 9547 for the MTN users, and 075 27 39545. Or you come to MBN Clinical Laboratories, Arua, Plot 11, Oda Road, Anyafio. Thank you very much.
All right. Thank you very much, Mr. Charles Kayuzu, for giving in your time to educate the viewers of Arsenal TV, and also to the facility, MBN. We are grateful for giving in your facility and also your personnel to come and educate the viewers. I've been your host, Sunday Junior Tom, together with Sophie behind the camera. Till we meet again next week on Thursday, same time, with another exciting topic and educative topic for you, our viewers. Till we meet.